A patient has been administered isoniazid for the treatment of tuberculosis, TB. Which statement made by the nurse would be the most appropriate when teaching the client about this medication? A. This medication is known to cause peripheral neuropathy and therefore it is necessary to give pyridoxine prophylactically. B. This medication is associated with color blindness. C. This medication is expensive and may only be taken subcutaneously. D. This medication must be taken twice daily for 9 to 12 months. E. This medication must be given by DOT, directly observed therapy. The answer is A. This medication is known to cause peripheral neuropathy and therefore it is necessary to give pyridoxine prophylactically. Isoniazid is a bactericidal drug that is given for tuberculosis that has several adverse effects including peripheral neuropathy. This drug is usually administered in conjunction to other antitubercular drugs. Pyridoxine, vitamin B6, is recommended to be taken in conjunction with isoniazid to prevent neurotoxicity. Isoniazid is relatively inexpensive and may be taken orally or intravenously. It is not necessary to be taken under direct observation, and is usually dosed according to type of disease, active versus latent. The typical duration of administration is roughly 26 weeks. Color blindness is not associated with isoniazid treatment. All of the following changes may be seen in chronic asthma except A. Hypertrophy and hyperplasia of mucous glands. B. Destruction of alveolar septa and pulmonary capillaries. C. Epithelial desquamation. D. Deposition of subepithelial collagen. The answer is B. Destruction of alveolar septa and pulmonary capillaries. Chronic asthma can result in a situation referred to as airway remodeling, typified by the following changes: increased airway vascularity, epithelial desquamation, deposition of subepithelial collagen, and hypertrophy and hyperplasia of mucous glands and of the underlying muscle layer. Destruction of alveolar septa and pulmonary capillaries is a common finding in emphysema and does not present in asthma. At what stage are antibiotics effective in treatment of pertussis? A. Up to 6 weeks. B. Up to 2 weeks. C. Up to 8 weeks. D. Up to 4 weeks. The answer is D. Up to 4 weeks. Antibiotics have been shown to have very little effectiveness in treating a pertussis infection older than 4 weeks. Because of this, treatment with antibiotics to individuals that have been symptomatic for longer than 4 weeks is not generally recommended. A client is admitted to the ICU with acute respiratory distress syndrome, ARDS. The client has a recent history of bacterial pneumonia that has worsened and is at risk for hypoxemia. All of the following interventions apply to treatment for acute respiratory distress syndrome, ARDS, except A. An arterial catheter may be inserted to allow for blood pressure monitoring and ABG, arterial blood gas, blood sampling. B. Client may be placed in the prone position to increase the partial pressure of oxygen. C. Parenteral or enteral feeding will be necessary to meet high energy demands. D. The client should be given the highest concentration of oxygen that will yield a partial pressure of oxygen of 60 mm of mercury or greater. E. Daily weight should be taken to monitor fluid status. The answer is D. The client should be given the highest concentration of oxygen that will yield a PaO2 of 60 mm of mercury or greater. The oxygen concentration should be the lowest possible, due to the risk of oxygen toxicity seen in clients with FiO2, fraction of inspired oxygen, levels exceeding 60% for more than 48 hours. A young male presents to the emergency department after a motor vehicle accident. Upon examination, it is found that the client will require a chest tube to reinflate his collapsed lung. All of the following correctly describe how a chest tube is placed except which of these? A. After placement, the tube is sutured to the chest wall and a dressing applied. B. During insertion, the tubes are to be clamped. Once in the pleural space, they are connected and unclamped at that time. C. A common location utilized for insertion is the fifth intercostal, mid-axillary line. D. If performed at bedside, sterile technique must be utilized. E. If air is to be removed, the chest tube is placed inferiorly and posteriorly. The answer is E. If air is to be removed, the chest tube is placed inferiorly and posteriorly. The correct placement of tubing includes directing a tube apically to remove air from the pleural space, and to direct the tube that will drain fluids in an inferior and posterior orientation.